and yourself. So, kindly pardon me if your hunger makes you angry with me. So with this, must thank the organizers for permitting me to come and share some of the observations on this, what I may see it as a very serious topic, very abstract as well, and which understanding of this will have far-reaching impact in our day-to-day life, and for me as a psychiatrist, it will have a far-reaching life as well. With the prayer, Trayambakam yajamahe sugandhim pushtivardhanam urvarukamiva bandhanan mrityurmukshiyamamrutat. The Mrityunjaya Japa we have all heard, and we have been told about this. Before going to the topic of today's presentation, I must recall one anecdote or one event that happened when I entered the anatomy lecture hall on the very first day. I was probably about 16 years old. Anatomy was something that was very sensational. We've all heard there are going to be dead bodies, there are a lot of smell, and so on and so forth. The introduction was made by one of the teachers, yet of course, this was in 1971. Wouldn't remember as much about that person. He said, look, those bodies which are there on each of the dissection table are not some inanimate objects which you are going to be cutting and seeing. They all came from a person like one of you who lived. So be respectful to the body. There may be no life, but the soul exists there. That soul doesn't have a body which has life. All of us, today I can relate it to what I am speaking today, but then a teenager, it looked very silly. But what he said was actually very impactful, very profound. He said, respect the body. When you are dissecting each organ, when you are dissecting each part, remember that body is teaching you, and that soul would actually be happy that the body of its earlier life is creating so many doctors. So, remembering this anecdote, which made me continue to learn from those who are sick, who are not conscious, who are on ventilators, and those psychiatric patients who came with a condition called as catatonia, wherein they wouldn't respond to me, they wouldn't even talk to me, they would look stare blank somewhere as if they are not living. But psychiatry teachers also told me, when he is not responding, does not mean that he is not listening to you. When the person is on a ventilator and unconscious, don't imagine that this person is not seeing, listening to what you are all saying. Something could be happening. There could be some other sensation through which he is perceiving what is happening around. And some examples were told today. And thanks to Dr. Nareshji, who has made my life simple. Some of the contents of what he spoke but also part of my lecture, I have reduced it to just a single slide. So having said this, having made this point, a small clarification about rebirth and reincarnation. Often we use them interchangeably. In fact, the dictionaries say so, rebirth is reincarnation. But there are some subtle differences which culture to culture perhaps talk about. Of course, the rebirth and reincarnation, some people say the rebirth is a concept from Buddhism and reincarnation from Hinduism. But there are some subtle differences which I have enlisted here. I am not going into a discussion on what is rebirth and reincarnation. Suffice to say that there are some subtle differences which the latter probably has a divine purpose. And a few other differences which I have enlisted here, just for sake of completion of this talk, I have mentioned it here. This is not an issue which we are going to be debating for the purposes of my talk, which is the mental health perspective of this subject of death, dying, rebirth and reincarnation. What is the point in discussing this? What is the point in discussing this subject itself? In fact, right from the time when we heard in Bhagavad Gita, that was also alluded to in the morning from my previous speaker, that birth and death are polar ends of the two, and we have to discuss as much importance, we should give as much importance to birth and life so much as to death as well. And so, merely by that fact, we probably have a case to discuss this subject today. But of course, there are, from time immemorial, discussions have been going on and on and on. Answers may have been found, may not have been found. Some realize the answers, some don't get the answers, some don't question at all, some question these things used, but it goes on. But discussion has a point, and many concepts that we talk about are religion specific. Of course, most discussions might have happened in our Sanatana Dharma or in the Eastern philosophies, where of course the Nachiketa Yamadharmaraya discussion to what is the discussion between Arjuna and Lord Krishna. This issue of death and dying and what happens after this is something that has been debated, and even today we don't have the answer. I have requested Swamiji what the statement Bhishma said, the very cryptic one-liner which we are going to find an answer in the next 24 hours after all these discussions happen. Hopefully we get the answer. Otherwise, now I am requesting him to explain to us what that message of Bhishma for us to understand and take our life forward. So, discussion is relevant, discussion has importance, but how much we discuss, how much we understand, how much we translate those thoughts into action varies from individual to individual. And of course, in the West also they talked about, it is more worldly, but of course discussions on death have happened, and there are several issues. They also alluded to a spiritual dimension of study of death, dying, grief and so on and so forth. Just to mention for sake of completion that as much as we are talking about death, there has been some thoughts of thanatology that have happened in the Western philosophies as well. But coming to psychiatric aspects, although there are several concepts which are relevant, I have taken only one concept of the death anxiety and how many philosophies from India have helped in understanding this, treating this condition or helping this condition, alleviating this condition or mitigating this condition. The one which Dr. Nareshji mentioned is another part. There's of course a grief is another part, and I am not going into those as much at this point of time. What is death anxiety? It is a sense of panic. It's a sense of being fearful about the thought of death. I'm sure most of us have experienced this about death of myself or death about my kin. That makes me very fearful. And if this thing is continuously happening. This thought of death and that fear is continuously happening, and we would probably call it as an illness. I'll come to that little later. The thoughts may be merely the death itself or the process of death. And the process of death, I'll come to little later. The whole feelings of the preoccupation, the fear actually interfere the activities of daily life, and if these condition lasts for sufficiently long period, for purposes of operational diagnosis, we say if it lasts for 6 months or longer, we give a clinical diagnosis of death anxiety. And there are, of course, many other things that we see in these people. They are continuously preoccupied with medical diseases, that they have some serious disease and there is some small region where discoloration of the skin has happened. They think it could be cancer. I need to get this investigated. And they want to avoid situations where, what if I go and they make a diagnosis of cancer? What if they go and they make a diagnosis of a serious disease? I don't want to go and get tested. Oppositional reactions also happen. It happens in about 3 to 10%. Various surveys have happened, 3 to 10% of people get it. And in childhood, the thoughts of death are the fears that they have, whereas in elderly people, the process of death, so much of suffering, something else will happen, I'll become paralyzed, and there's no one to care, and so on and so forth, progresses on to what will happen. The process of death causes the death anxiety. There are, of course, it is commoner, the risk factors include, it is commoner in either childhood or in the elderly individual. It is more in women than in men. Apologies to all the women here. It is a surveys that have given the data, I am sharing it with you. Disbelievers of religion, of whichever is the religion, are more likely to have the fear of death, and those who have a chronic disease which is progressing are more likely to develop it, or those who have been recently diagnosed as a serious disorder, cancer or untreatable infectious disease or degenerative disease, are the ones who are more likely to be having it, and those who have been recently bereaved. Somebody lost a very dear individual in the family, or those who have been living alone are more likely to be having this death anxiety, and those who have continuous feelings of low self-esteem and some sort of dissatisfaction about their life are more likely to have this symptom as well. And of course, there are other examples of behavior related to death which we are talk about. One is, how do I conquer death, which has been ubiquitous, and we have heard from time immemorial various stories and even various tapas that happens, and the boon they ask is, I should never be dead, I should never be killed, and it goes on and gone. The concept of amaratva and the fight for the amrita so that I will remain eternal, we have heard it from age immemorial. And also, how to avoid getting aged is also another concept which is related closely to death and dying and death anxiety, which I should not get aged. And people do all these things. And of course, they resign to the idea that of course I will die, and then they start praying anayasena maranam. This shloka, we have heard this. So pray to the God, at least when I die, I should not have any serious problems, and I should have a nirayasa maranam. So the good thing about it is, very often it's a self-limiting condition. It can happen in most people for some periods and it goes away for various other reasons. They probably reconcile to the situation and they probably adjust themselves. The passage of time, a lot of people help, there are a lot of support that are available in our society, a good family life, and then the reassurances from the kin. They can start sharing concerns with each other, and of course, a lot of positive events can happen. A grandchild comes to the house, and so on and so forth. Things get better. And of course, they start looking for a meaning in life, and all that they had done was probably carried a meaning. have a purpose, a spiritual outlook, makes them actually feel better. And of course, there is a treatment available. Elsewhere, textbooks say you should use the cognitive behavior therapy outside, but of course, in our concerns, we have many ways in which we can treat this condition. We have, one of the fears is fear of death in others. Very close person is dying, and of course, there are, following that, guilt will come up. Maybe I did not recognize the illness in this fellow earlier. Had I been treating him, taken him to treatment earlier, maybe I would have been less guilty. I would have at least done my duties and so on and so forth. And of course, for this, a form of cognitive therapy is known in Bhagavad Gita, which is of course the mother of all therapies. And we have heard the shloka in the morning, and they says the body may die, but you don't die. He doesn't die at all. So the shloka is of course very popular from Bhagavad Gita. I don't want to recite it. And of course the soul just changes into another body. So you don't have to feel really guilty that you did this. And of course this form of cognitive behavior therapy exists in our Gita itself. Loss of separation. I lose somebody and I start feeling, once I die, I will lose contact with those people. And this concept comes back with that Punarjanma concept, which reassures the individual that of course I am going to be with this person, I am going to meet this person in the next Janma, and so on and so forth. This of course is very reassuring to these individuals. The concept of rebirth can have a very supportive value. The positive when this happens, the Punarjanma concept again comes to my rescue. You have some more time to do it. You've got to do it, you will be successful, and that reassurance, you get it from this concept. My colleague earlier also spoke about these near-death experiences, which was first described in 1975. I am not going to go into this because most of it has been very eruditely covered by my colleague. Having to make it brief, I am coming to the last two slides of my presentation. There has been a thought thrown by many of my senior teachers that depression, suicide, guilt, this morbidity, and also the death of fear of anxiety, the fear of death, this anxiety, death anxiety, could be lesser in our community. This is some surveys that have shown. And is this true? And it could well be true, because in our concept, we're talking of the rebirth concept, which is reassuring, as I mentioned. The concept of punya, my account for punya keeps growing up, and so probably this will help me to lead a better life. And so the feelings of guilt would probably come down with the concept of punya, and then the depression also gets better. And spirituality has something become ingrained in our land. Many scripts which talk about and enriches our spiritual life, and those who have a more spiritual thinking are less likely to get attracted to these conditions. Gita is another example. You read Gita, and I do my duties, and that's it. I don't have to be necessarily feel responsible for this. And this might have immunized my society against death anxiety, the grief of bereavement, and the depression in adults. And it's been argued by many of my senior teachers that there could be an inherent mechanism in our society to protect the society against from being haunted by depressive feelings. So, looking at these perspectives, mental health perspectives of this concept of death, dying, rebirth, and reincarnation, the spiritual life in our dharma, spiritual thoughts in our dharma, and its lifestyle can be protective. I think we should all continue to practice that. The spiritual thoughts, spiritual lifestyle has actually influenced these concepts related to death, dying, and even the rebirth. they have a hidden force to be able to perform punya, do something good to the society. And that means a societal harmony is maintained by these thoughts. I think that is something that we need to look at. Given the death is a process that is going to happen, but it has to happen smoothly, and that I have to perhaps welcome it, because if I have done a lot of punya, I may not have to come back at all. But if I die, it is just I am changing my body. I am getting a new dress. In both ways, Dr. Naresh mentioned all the experiences of near death, at least in majority of these clients, were pleasant, although there are some concepts of negative experiences in a small proportion. But in most people, the welcoming idea of death is something that we will learn from our spiritual enlightenment and our learning of spiritual practices. So I perhaps stop here, giving you a very brief overview of the mental health perspectives of this concept. I thank Goddess Ma Saraswati from leading me from this ignorance of darkness to the wisdom of light, to be able to share these views with you. I thank all of you for giving me a patient hearing. And here is my email address. If there is anything that you have to share, please go ahead and write to me, because they're not going to permit any more questions in this session because lunch is ready.